Hello, everyone. My name is Josephine Mbidde. I am the Senior Technical Advisor in the AIDS Support Organization, also known as TASO. I'm responsible for overall coordination and oversight of implementation of malaria activities by sub-recipients in 67 districts across the country. I'm also responsible for ensuring continued collaboration between TASO and other key stakeholders in the malaria space at the national and subnational levels within the same districts. My project title is Strengthening Community Systems to Advance Health and Equity Efforts Against Malaria in Pregnant Women and Children Under 5. Despite the considerable control efforts to reduce the burden of malaria in Uganda, it still remains a leading cause of morbidity and mortality, accounting for 30 to 50% of all outpatient consultations. There are many reasons for this, but one that stands out is the complacency about malaria, resulting in poor health-seeking behavior and treatment compliance and laxity in community use of malaria prevention and control measures. Children under 5 years and pregnant women are at a high risk of severe infection and face challenges in accessing quality malaria services. It is therefore important to heighten efforts to increase risk perception at the household level and hold the household accountable and responsible for preventing malaria in the home. This project was embedded in an already existing pilot intervention that started in late July, early August 2023, at a time when the country was experiencing upsurges across a number of districts. It is based on a household cluster model. It was implemented in 5 high-burden malaria sub-counties in 5 districts and aims at empowering households to reduce the malaria burden by preventing a mosquito bite and strengthening adoption of social behavior change malaria approaches and improving health-seeking behaviors at the household level. Key activities included stakeholder engagement, orientations, review meetings, transect walks, mobilizing and sensitizing households, monitoring and evaluation of activities. Preliminary findings show a downward trend in test positivity rate in the intervention sites, but also an increase in the number of women in their first trimester attending their first antenatal visit. On average, positivity rate reduced by 15% in the intervention sites compared to the 4% increase in the control site. Also, on average, the proportion of pregnant women in their first trimester attending their first visit increased to 40% in the intervention site compared to only 18% increase in the control site. In the intervention sites, we also noted improved home hygiene and sanitation due to the integration aspect of the intervention, and we also noticed reduction in household expenditure on malaria treatment. There were high expectations from the community, and yet limited availability of nets, malaria commodities, and repellent plants. We incorporated net distributions during outreaches, worked with health facilities to redistribute commodities to the community, and advocated and worked with schools and health facilities to avail the plants. For stakeholder engagement, we leveraged on feedback from the communities for improvements and worked with their community leaders as key implementers to promote ownership for the activities and the results, and also to follow up on agreed actions after the activities. There is limited funding for scale-up and sustainability of these interventions and activities, and we hope to leverage on the new grant to identify funds to scale up the activities. Looking at the leadership journey and the 4 pillars, the first one, looking at authentic leadership. The journey emphasizes on significance of self-confidence and effective communication. This has helped me to speak up confidently, to articulate my ideas and be heard. Under inclusive leadership, I have built networks through the leadership project, which have enhanced my interpersonal skills and created opportunities for collaboration and knowledge exchange. For strategic leadership, I've embraced feedback, which has promoted self-awareness and allowed me to identify my strengths and areas for growth crucial for my effective leadership. And under impactful leadership, I have gained invaluable insights and tools through the touchpoint sessions, mentorship and coaching sessions that I will apply as a leader to impactfully contribute positively to the healthcare sector, specifically addressing healthcare needs of vulnerable populations, such as the pregnant women and under 5 age group. Thank you for listening, and thank you for your time.